So if you see our gallery here, it explains how Afya Mtanni started. Here from Huruma and Madare, we did the door-to-door screening. After the pandemic, we came up with the idea of there was a gap in healthcare within the slum. So we came up with the idea of starting the clinic within that area so that we can bridge that gap. That is how Afya Mtanni Clinic came to be. So with your support, we were able to with your support, the clinic would run, and we continued with the outreaches. As you can see here from the photos, until late last year when the insecurities were too much, and also the revenue that we were getting, because it's a slight low income area, it was very hard to sustain the clinic on our own. So we thought we could not close it because our heart is with the community. So we wanted to find a way of generating income and also still doing the community work. So that's how we came to know this place, and we set it here. So with here, at least the clinic can sustain itself, and sometimes the small margin of profit that we get, we are able to do some outreaches. So some of our clients, like this mom here, she still comes all the way because our services for the community people in Huruma and Madare are still subsidized. So we are still in touch with them, and we do outreaches there, and we also monitor our clients from there. So with this project here, we are able to sustain the community projects and also sustain the hospital. And we are so grateful for the support that you've given us so far. So this is our pharmacy. This is where we store all the drugs.
Before Afya Mtanni come to our community, most of us were acting like zombies. Even I cannot be even responsible. I cannot be having I cannot have this responsibility or this nature of talking to someone like you. I was just bitter to anyone due to my life.
This is our consultation room. So this is where the doctor sees the patient. This is where the patient sits, and this is the examination bed. The space is squeezed because we really had to make it manageable because we didn't have enough space. But now this is the consultation room. This is where all the patients are screened. So we take the weights from here.
Just to add on, all the furnitures you see in this hospital was supported by Peter Bergman Foundation.
This is our lab. These machines, we got it from PBF. When we started the clinic, and they've been so helpful for us. So this is the lab area. The machines, the laboratory. We have the microscope and the full hemogram machine and
OPD.
It's OPD. But in cases where we have night emergencies, we just submit them throughout the night. For ultrasound, we use it also as an observation room. And all this we got it from PBF.
Family.
Because
Okay.
So at Afya Mtanni, we do our outreach after every 3 months. Together with Zizu, who is a member of Afya Mtanni, we are able to do mobilization and advertisement for the free medical camp. PBF has been supporting this free medical camp. Right now we are located 3 kilometers away from Madare slums, but the reason why we are here is for sustainability purposes. Back in the slums there, we can't be sustainable because a lot of our clients come and we treat them for free. They won't pay for our charges. And PBF gave us machines, medical equipments, the ultrasound, the full hemogram, the medicoscope, and also it has taken one of our students, Kevin Karejo, to the university, who is now a graduate and working in a private hospital. We work here as a team of 6, and as my colleague Eunice has explained, it started way back during COVID. So I'm grateful for this support, and we are just hoping one day we get space to expand our rooms for our people to reach our services. Thank you.
So my name is Faith. I'm a clinician around here, and I'm proud to be working with this facility here. I believe with commitment and the support we are getting from the community, we can go far. So this guy here is my patient. I have been following him for some time. It's like 2 months now. He's been having a skin issue. He has a skin issue, and I have been giving him medication. It's slightly improving, but I believe we are heading to the right direction. Yeah, so we just need more support so that he can get the right treatment. Yeah.
It is devolved. People can start their small clinics to serve the small people. And it works because for you to live here and go to the big hospital, you can't afford it. So we get it closer to the people, and for that one, the government of Kenya, we appreciate that the services, and there is innovation for the professionals to start their own little clinics and use innovative ways to do so much in a very small area. The machines that we got from PBF 2 years ago are still very helpful to us, and in so many people in this area, they come here for these services, and it trickles down to so many people. So the challenge we had is just the security, because these are very expensive. Somebody can just walk in with a gun and take all of them. So we better stay in a safe place, even if it is small, and the people come to us.
Regarding the space, I think people are thinking the bigger the better, no?
Yeah.
Here you have the smaller, the more intensive,
Yeah.
and more concentrated.
Yeah.
But you see, the people, you do not judge regarding the space.
Yeah.
I think what I am very much impressed, that it is possible in such a small space to do such a high qualified service to people,
Yes.
because always health is
Basic.
the highest is the basic.
Yeah.
Yes.
It's a very high value,
Yeah.
and you consider it the smallest conditions regarding the space,
Yeah.
and it is outstanding in a way.